Assalamualaikum warahmatullahi wabarakatuh. Good evening. So my name is Alif Rafqy Irawan, and I will be presenting a medical journal with the title of Music Intervention Approaches for Alzheimer's Disease, a review of literature. This medical journal is written by Melissa Leggieri, Michael H. Thaut, Luis Fornazzari, Tom A. Schweizer, Joseph Barfett, David G. Munoz, and Corinne E. Fischer. So our lecturer, my lecturer, is Dr. Wisma Yunita, MPD, and I am from Pendidikan Dokter Fakultas Kedokteran Universitas Bengkulu 2020. So I'm going to move on to the next thing. So the introduction of this. So music interventions have been widely adopted as a potential non-pharmacological therapy for patients with Alzheimer's disease to treat cognitive and or behavioral symptoms of the disease. In spite of the prevalence of such therapies, evidence for their effectiveness report mixed results in the literature. So Alzheimer's disease is the most common form of dementia, with an estimated 15 million people living with the disease today, based on World Health Organization 2018. It is marked by decreased cognitive functioning, memory, visual-spatial issues, and executive functioning, emotional control, and neuropsychiatric symptoms such as apathy, depression, and agitation, based on the GATSOS 2002. So medications for AD aim to improve cognition and relieve behavioral symptoms. However, many approved drugs provide only modest benefits for the patient, based on Thaut L 2003, KCIL 2010. As a result, there has been an increase for research for non-pharmacological interventions to reduce symptom burden for AD person and their caregivers. Music, well, is highly versatile and accessible, which allows it to be used in patient population in a variety of ways. Reglio and OSE 2015 described three music approaches used in clinical settings: music therapy, music listening, and general music-based interventions. Music therapy is defined by the Canadian Association of Music Therapists 2016 as a discipline in which credentialed professionals use music purposefully within therapeutic relationship to support development, health, and well-being. Music therapy involves a crucial component of client-therapist interaction through an empirically supported model and can consist of active involving improvisation, singing, clapping, or dancing, and or receptive music listening purposefully to identify emotional content emerging from music techniques based on Raglio and OAC 2015. So the aim of it, okay, the aim of this very, very research is, so the purpose of this narrative review is to investigate the effectiveness of various intervention strategies, just music therapy versus music listening techniques, and music type used in an intervention, individualized for non versus non-individualized music, on cognitive and behavioral outcomes for persons with AD. Regardless of the mixed results in the literature, many clinicians and researchers suggest that music should be used in a medical setting. In this review, we will examine the existing literature on music interventions involving individuals with AD dementia and summarize the various techniques used and their impact on cognition and behavior for this population. So, what are the methods that has been used by these very, very people? So, databases research for studies using either active music therapy or music listening techniques over the last 10 years. These studies were in English, included persons with AD dementia, and whose protocol gathered pre and post intervention outcomes measures. So the intervention must meet the definition as either music therapy, music listening, or generalized music-based interventions. Generalized music approaches without a music therapist must be validated by a caregiver or conducted in a controlled setting to ensure adherence to protocol. The studies gathered in our review included only patients with AD dementia. Studies that were excluded included reviews Letters to the editors, studies which did not involve a music intervention or included an intervention other than music approaches, studies using a mixed intervention strategy, or studies that included a diagnosis of dementia other than AD, such as vesicular dementia, such as vascular dementia, Lewy body dementia, or mixed dementia. The electronic database Medline, PubMed, and PsycInfo research using the terms AD and music intervention or music therapy or music-based intervention. The abstracts of all results from research were read and sorted whether they are adhere to our inclusion or exclusion criteria. These papers were then read for their entirety and further exclusions were made based on the inclusion criteria. So what's the result? So our analysis of these papers suggested that regardless of the music intervention approach, individualized music regimens provided the best outcomes for the patient. Furthermore, music listening may act as a relaxation technique and therefore provide a long-term impact for the patient, while active music therapy may act to engage participants through social interaction and provide acute benefits. Our investigations provided evidence that the intervention approach used may also have an effect on cognition and behavior. Namely, Sakamoto, 2013, uniquely compared their generalized music listening intervention to an active music therapy group and found that both methods of treatment showed generally significant results in behavioral symptoms such as anxiety and affective disturbance. However, those who underwent music therapy experienced additional benefits compared to the music listening group in the domains of paranoid/delusion, aggression, activity disturbance, and overall rating of behavioral symptoms in persons with more severe AD. However, these results disappeared after the intervention. Conversely, the other two studies utilizing active music therapy provided conflicting results on both cognition and mood. What are the conclusions of that? For the Paul McCartney, the grandma with the headphone, the photo of Jimmy Page and the Angus Young, and this David Gilmour, which is bring the most calm music, Pink Floyd. So our findings of all of that suggest that music techniques can be utilized in various ways to improve behavior and cognition. In summary, our investigation into the aforementioned studies suggested music intervention which use individualized music playlists and focus on relaxation techniques tended to yield greater benefits on 80%. We hypothesize this is due to the enhancement of autobiographical memory, autonomy, and parasympathetic modulation, which in turn has positive effects on cognition and behavior. Although many studies have investigated outcomes pre and post music intervention for 80 persons, there's a lack of studies investigating brain changes associated with the music intervention. As well, imaging studies investigating brain areas involved in music listening have thus far only been investigated in healthy young controls. Such studies could provide empirical evidence to further the understanding of mechanisms involved in musical memory and how music can work to improve cognition and behavior in person with AD. So there you have it, folk. Thank you very much. And this is a photo of AC/DC, which is very good. And if you're going old, just use music and it's gonna be good. Okay. Thank you. Assalamualaikum warahmatullahi wabarakatuh.